Magnetic Nanoparticles in Cancer Therapy and Diagnosis by R. Gardi, Alvaro Garcia Blanco, Devansh Dayal, and Josh Rubio. And this is our presentation on our article. The purpose of this article is to review the advancements and applications of magnetic nanoparticles in cancer therapy and diagnosis. It explores how magnetic nanoparticles can be used to treat targeted hypothermia, control drug delivery, and enhance imaging in cancer patients. Additionally, the review discusses the remaining challenges such as improving magnetic nanoparticle stability, optimizing magnetic properties, and ensuring biocompatibility for safe and effective clinical use. And on the right is a diagram that shows all the uses from the hypothermia, magnetification, drug delivery, photodynamic therapy, and photothermal therapy, and all the branches that branch out from those. And now my teammate Alvaro Garcia Blanco is going to take over the presentation for the next slide.
Okay, so I'll be telling you all about the types of nanoparticles. It's important to understand which types of nanoparticles work, and especially for this application, the most favorable ones. The main nanoparticles discussed are iron oxide, chosen for their high magnetic saturation and favorite biocompatibility profile. These properties allow them to be manipulated under magnetic fields without causing toxicity, which is very important for the patients, marking them suitable for biomedical applications, in our case, cancer. Besides iron oxide, variants like manganese ferrite and cobalt ferrite have been explored. The variants can be modified further by embedding them metals such as gold or gadolinium to enhance imaging and thermal properties for dual imaging and treatment functionality. So this is right now being explored, and it's a way to enhance potential imaging to see the treatments. The article describes the MNPs generally range from 10 to 100 nanometers, with 30 to 50 nanometers being ideal for the intravenous application. The size range allows MNPs to circulate effectively in the bloodstream and accurately and accumulate at tumor site. So this is for more precision treatment and for them to getting exactly where you want them. Additionally, the spherical shape of most nanoparticles ensures stability and uniformity in behavior with the bloodstream, which is essential for the reliable targeting and consistent therapeutic effects. So this is to have a continuous and repetitive, accurate approach to this treatment. And this is why nanoparticles are being not only studied, but seeing good results with. Lastly, the article mentions that these nanoparticles can be surface modified for dual or multifunctional applications like attaching targeting ligands to enhance specificity for cancer cells. So this is once again just to become more accurate, more localized, and try to not affect any other areas of the body. Next, my team at Devansh is going to be talking about some of the applications with these cells that we've discussed, or nanoparticles, sorry.
So on this slide, I'm going to explain how magnetic nanoparticles, or MNPs, as referred to throughout the slides, are used in cancer treatment, specifically through a technique called magnetic hyperthermia. So when MNPs are exposed to an alternating magnetic field, or AMF, they start producing heat. This happens because of magnetic hysteresis loss and relaxation effects, which I'll further talk about in detail. Essentially, the nanoparticles lose energy as heat, which raises the temperature of the tumor to around 42 to 45 degrees Celsius. This temperature range is crucial because it's enough to trigger apoptosis, which is also the programmed cell death in cancer cells, which damages the cancerous tissue and it protects the healthy tissue. What makes this method so effective is that the alternating magnetic field can be controlled externally. This allows for precise temperature regulation, which minimizes harm to the surrounding healthy cells. Also, cancer cells have impaired blood flow and cooling, making them especially vulnerable to the hypothermia treatment. Now, the challenges solved by MNPs are that the traditional hypothermia treatments like radiofrequency and microwave heating have a big downside. They are not specific at all. This means they can accidentally overheat and damage the nearby healthy tissue, which is what we don't want. Now, the MNP induced hypothermia has a benefit. This is highly localized, which makes it much safer and more focused on treating the tumors that are actually cancerous. Now, what's really exciting is that hypothermia treatment with MNPs has shown promising results in preclinical models. When used alongside chemotherapy or radiation, it has shown significantly reduced tumor sizes. Furthermore, it provides localized heating as aforementioned. Now, one another application I'm going to talk about is the targeted drug delivery. So MNPs can be loaded with chemotherapeutic drugs and directed to tumor sites using external magnetic fields. The drugs are then released in a controlled manner, which minimizes the side effects. An example which was mentioned in the article was the doxorubicin loaded core shell nanoparticles. These MNPs release doxorubicin upon heating in an acidic tumor like environment, ensuring high drug like concentrations in the tumor and reducing systemic toxicity. The figure 2 on the right side of the slide also provides a schematic view of how alternating magnetic fields interact with the magnetic nanoparticles. In the next slide, I'm going to further talk about the role of magnetic nanoparticles. Now, the magnetic nanoparticles are engineered to interact with an external magnetic field, which gives them the ability to generate localized heat, which can be harnessed for targeted cancer treatments. Now, the first point is the super paramagnetic behavior of MNPs, which means that they align with an externally applied magnetic field and produce heat. This effect allows for the concentration of heat at the tumor site itself, limiting damage to surrounding healthy tissues. Now, the heat mechanism which I was going to talk about was the Neal and Brownian relaxations. Now, Neal relaxation refers to the heat which is generated as magnetic movements inside the particles rapidly flip. And the Brownian relaxations, on the other hand, refer to the whole nanoparticles which flip on their own. This mechanism allows for precise heating, disrupting cancer cells' functionality. Now, the cancer cells are more vulnerable to heat because they have less efficient blood flow to cool themselves. Once the temperature exceeds their threshold of 42 to 45 degrees Celsius, the heat can trigger cell death via apoptosis. Now, to increase their stability and targeting capabilities, MNPs are coated with materials like polyethylene glycol or PEG. These coatings have three benefits. They prevent clumping in the bloodstream, they reduce immune detection, which prolonging circulation, and they enhance targeting. Now, in the next slide, my teammate is going to talk about how the rise in technology helps nanoparticles.
So one of the current technologies that we're improving upon is traditional hypothermia. Now, with traditional hypothermia, methods like radio frequency or microwave hypothermia are not as targeted. So one fundamental flaw is that it often damages surrounding healthy tissues. Now, one thing that we can do is using magnetic fields. The advantages to this is the localized heat delivery reduces the risk of collateral damage, making cancer treatment often safer. Another one is conventional chemotherapy. For conventional chemotherapy, high doses of this can affect healthy cells, leading to severe side effects such as hair loss, immune suppression, and organ damage. However, the improved delivery allows for MNs to reduce the systemic toxicity by delivering drugs directly to the tumor site instead of affecting the surrounding healthy tissues such as the other traditional types. Now, a third one would be conventional MRI. They have limitations in contrast and resolution, whereas by using the magnetic nanoparticles, these MNPs can improve imaging quality by aiding in early cancer detection and better monitoring of treatment progress. The authors argue that MNP's ability to combine multiple functions sets them apart from current methods. So this is why that it is crucial that we start using MNP technologies as it not only ensures patient safety and it pushes the future forward. Now to close off, I'm gonna hand the references out to Alvaro Garcia.
So as you can see, so these are some of the references that we utilize to get this information, as well as the article, and some of the few key takeaways that we've talked about. So precision and control. MNPs allow for localized treatment, sparing healthy tissue and improving the efficiency for traditional cancer therapy. So that's very important, just because in most cancer treatments, what people are worried about the most is like the side effects and all the stuff that's gonna be taken down on their body. But if there was something that could just attack the cell itself independently, it would be much better for the treatment. So this is why people are looking into this. And then theranostics potential, the dual use nature of MNP's therapy plus diagnostics, like Josh mentioned, they can also be really good for imaging and just getting a whole lot more information and knowing really where the cell is and how it's looking and size and everything to see if maybe a surgery could be possible. So imaging is just as good as actually treating them. And while this is promising, more work is needed to translate these findings into an everyday medical practice. But the research is hopeful, and it seems that this could be something that we could be looking at as a just common treatment in the future. And now, just to close enough, I'm going to be handing it back to Josh for the closing thoughts.
One quote that I find beautiful is that research indicates that magnetic nanoparticle hypothermia can enhance chemotherapy effectiveness by over 30%, allowing for lower drug doses for fewer side effects. This is very promising considering the fact that cancer is a very dangerous disease to our society as a whole, and that we can give patients a hope to look forward to instead of giving them doom through chemotherapy.
Thank you.